All right. Thanks again, everyone, for joining. So I'm going to give a quick introduction of We Robotics and what we do and Flying Labs, since this is an external webinar and we have people over the world for this Redwing webinar. So We Robotics, who we are and what we do. We Robotics, we shift the power with local experts in Africa, Asia, Latin America, Caribbean, and beyond. We are a social impact organization, and we bring local experts from communities and activists doing practical alternatives to systems normally dominated by foreign-led and top-down interventions. So we really focus on the ground roots initiatives and working from the bottom up instead of the top down. So we're co-creating and facilitating, and we're inclusive and sustainable and network of local drone, data, and robotics leaders in Africa, Latin America, Pacific, Asia Pacific, and Caribbean. And it's a conglomerate of the Flying Labs network. So by doing an effective and practical model that others can adopt and replicate to accelerate locally led efforts in response to pressing challenges around the world. We Robotics, the key role is to support the Flying Labs network so that individual Flying Labs and the network as a whole can grow and thrive sustainably. We're all about sustainability, and we want to make sure that the power is truly local. We the network, and we are good stewards of the Flying Labs network. And that is how we work together with the Flying Labs. We help with technical capacity strengthening, knowledge exchange, technology transfer, sustainability, capacity strengthening, and we do shared governance, monitoring, evaluation, and learning, network model improvement and documentation, as well as opportunity and value transfer. The Flying Labs Network. We're going to be hearing from the Flying Labs today. We'll have a good discussion, I hope. So the Flying Labs Network, our global network of independent entities, it's a conglomerate of over 40 plus countries, all convening as local experts in professional drone data and robotics and AI services. The Flying Labs collaborate with community partners in the humanitarian, health, and environment and development sectors. The Flying Labs strengthen local level capacity within their communities, and they help to catalyze positive impact. As they grow and as they work with the Flying Labs in different countries, as We Robotics works with the Flying Labs, it creates diverse services in individual countries globally. Flying Labs are financially independent from We Robotics. They offer their own training and professional services to local governments, businesses, NGOs, academia, and international organizations. We're really excited to have everybody here today to join this We Robotics live webinar. We're calling this the Sky High Savings, Shrinking Out of Pocket Expenses with Drone Delivery. This is by Redwing in India. So Rishabh and Kundan are incredible people who are working at Redwing. Rishabh is the co-founder of Redwing, and Kundan is the head of business development partnership. And we are truly excited to hear about how their impact and key learnings from the last 2 years are enhancing healthcare logistics through drone technology in India. And we're excited to hear about where they're doing and how this is advancing the drone industry. Rishabh, the co-founder of Redwing, he is incredibly accomplished and really an amazing person to get to know. He's pioneered the integration of drone technology into delivery services, focusing on significant sectors such as healthcare. He has an incredible background with a degree in mechatronics from Manipul Institute of Technology and expertise as a disciplined Agile Scrum Master. So we're really, really looking forward to hearing more of his background, as well as how he co-founded Redwing and the story behind that. I would love to hear more from Rishabh as he continues in his presentation today. We will also hear from Kundan, who's the head of business development at Redwing and partnerships. And he, again, everyone here has a very impressive background, so I want to make sure that we do them justice and hear from them how extensive their experiences actually are. But he is in charge of strategic partnerships and market expansion, and plays a crucial role in driving the adoption of drone delivery technologies across new sectors. So we are very much looking forward to how this is enhancing healthcare systems. Thank you all. I'm going to go ahead and hand this over to Kundan. Thank you so much again for joining us today. We are truly grateful for your expertise and your knowledge that you're going to be imparting to us today. We're excited to have this for our partners, our local and global partners, as well as the flying labs and others that are joining us. So go ahead and take it away, and thank you again.
Thank you, Elsa, so much. Thank you for such a kind introduction, and thank you so much for sort of hosting this webinar. I think firstly, I would like to sort of thank everybody for joining us today, taking some time out, and understanding our journey so far in terms of what we've been able to do for patients in India, for healthcare in India, by utilizing drone delivery. And just to quickly touch up on the story of Redwing, right? Redwing was born back in 2019. It was born out of, let's say, looking at what was happening across the world with drone technology and how the adoption was going, growing quite quickly, right? So we came across a bunch of use case and picked healthcare because it was something that we really connected with. It was something that we really also felt could make an impact. And I think over the last 4 or 5 years of the company, right, we've been able to do quite a few things, right? So just to give you a little context about what Redwing effectively does, we're building automated logistic networks, right? These are networks that could deliver effectively anything from anywhere within the bounds of the network, right? So how we do it is we basically design, develop, and deploy these drones that partake in our networks to deliver medical supplies, right? Can we move to the next slide? Yeah, so I think over the last 2 years, Redwing is one of the largest drone delivery service providers in India, right? Not only have we been running the longest drone delivery networks in India, we've been also running the largest drone delivery networks in India, right? As a matter of scale, we run networks anywhere between, let's say, 50 to 150 kilometers, right? The nodes that we service can stretch beyond that too, right? By the capability of the networks that we have. Along with that, not only have we been able to create a lot of impact in the healthcare space, we've been able to increase the healthcare penetration across the geographies that we work in. We've also been able to, let's say, create a bunch of employment opportunities in the STEM field, right? So that's the impact that we've had so far of running operations live for the last 2 years in India, right? The reason why we do it, I think, is quite interesting to understand, and I think it's unfolded also quite a bit from our operations over the last 2 years. And just to shed a little light on that, I'll sort of hand the floor over to Kundan, who heads our business development and partnerships, to take us through the journey of, let's say, why rural healthcare in India is so challenging, and how are we addressing it at this moment. Over to you, Kundan. Thank you.
Yeah, thank you, Rishabh, for setting the context. So as the title itself says, that primarily the discussion is going to be focused around how drones and aerial logistics have benefited partners and beneficiaries in the rural healthcare space. And so firstly, I'm going to put some context on what it means to work in rural healthcare, what are the challenges that we're trying to solve, and what are the benefits that our drone delivery networks have created in the last 2 to 3 years working in the Indian rural healthcare space. So one of the main challenges that we have seen in India, and of course this is true with many of the developing countries in the world, as the IMF map shows here, that a lot of the countries globally, especially in the developing world, the global south as we call it, don't have great road networks, which directly leads to challenges in transporting any kinds of goods, not just healthcare, but any transportation of goods and people is severely affected when the road networks are poor. And so the case is similar in India. Again, different states share different scale of challenge, but broadly, what we have seen in India is that as we go to the rural parts of India, road networks are always not very promising that allow for good access to take place. So most of the photographs that you'll be seeing in our slides are directly from our programs in India. So these are not taken off the internet, but photos taken by our team and our programs in the course of what we have done in the last 2 years. So one of the major challenges is the point of difficult road networks itself, right? And secondly, the other challenge that we see in rural parts of India is the difficulty or the insufficiency of public transportation. So the two slides post the contrast, right? The first slide shows that some parts don't even have great roads to begin with, and secondly, so that normally makes a person think that if there are good roads, probably access is solved directly. But what our experience has taught us is that just because there is a good road, it doesn't mean that access is directly solved. So as these two photographs portray, even in places where there are good roads, private transportation in India is not extensive. People that we are trying to serve, the rural beneficiaries, the tribal beneficiaries, often don't own a two-wheeler or a four-wheeler transport that would enable them to travel to a higher health facility. So even though there are good roads, the lack of public transportation just makes access very difficult. So in fact, most people, and this is surprising even to us when we started working, is that a lot of people in rural India still walk to their nearest health facility. And so so the first image actually signifies that people walking to a health facility, and places where there is limited shared transport, we can see that it's not regular and it's not consistent. So in fact, this is also one of the real photos that we've taken from our programs, where a vehicle that usually carries like 4 to 5 people, I can't even count how many people are sitting inside the vehicle, right? So it's that is how the scenario is in a lot of like deep rural pockets of India. And in fact, to show that this is the challenge in multiple places, right? We have mapped out a lot of these difficult access regions in multiple states, and as we can see, many states in India have red pockets all over the geography, which means that access is very difficult for a lot of these rural populations. Of course, some states find it more challenging, but overall, what we have seen is every state in India has a shade of that problem. So it's not limited to a specific state which probably has a mountainous terrain, but every state has pockets that where access is a major challenge. And the second, and not the second, but on the healthcare side, the other challenge is a lot of the rural health facilities, while they might be having minimal infrastructure due to lack or due to shortage of allied health professionals to, let's say, operate the laboratory machines or to even take care of the facility completely, we see that a lot of the facilities have infrastructure, but they're not functional. And these can be due to multiple reasons. Lack of allied health professionals is just one reason. We also have seen where power can be an issue. And when I say power, it's not as if the health facility doesn't have access to power, but these equipment need uninterrupted power. So if you're running a test and if you have a power cut, then you know that sample is gone and that you restart the whole process. So lack of regular power availability, supply chain bottlenecks, and let's say sending reagents to the last or the furthest health facility to enable the infrastructure to work, working cold chains to ensure that vaccines are always stored there or reagents are always stored there. So a combination of reasons makes health facilities not fully equipped to deal with patients. And and so what happens? And coming to the main point of the topic, right? And a combination of these problems, what it does is that it forces people to travel to a higher health facility. Because I don't have healthcare in my village or in my immediate locality, I'm forced to travel 10, 20, 50, sometimes even 100 kilometers to the nearest hospital, right? Some districts are quite large in India. And so the point of a district hospital, which is usually the biggest hospital in a district, in a district which is a region in India, can mean a lot, many hours and many days of journey. And I'll show you those numbers as well. And our interesting findings. So there are like two interesting findings that we have seen on the ground. The first one is not many people are willing to undertake this journey because this journey costs money, and out of pocket expenditure is a term that we often use in the healthcare space. But the missing component of that OP is the non-medical costs that are there in out of pocket expenditure. More often than not, we associate out of pocket expenditure with the cost of medicines or the cost of seeing a doctor, the cost of getting a test done. But the missing component that most people don't think of is that it would actually cost me money to visit a doctor or a health facilitator. I'd have to spend some money on travel, some money on food, some money on accommodation, because I have to probably stay for 2-3 days to get the health access that I need. And these costs are not low. And sometimes they can add up to almost 25% of the total health expenditure itself. And so the result of poor transportation, poor roads, and the local health facilities not functioning is high out of pocket expenditure. And because these costs are real, many people decide like not to even travel to a higher health facility. So in a way, that is the missing net altogether. Many people decide to stay back in their village by taking whatever local treatment is available, and we know the effects of it, right? If we ignore healthcare at a point when we need healthcare, then the disease or the problem only magnifies over time, and that becomes a much bigger problem. And so that is what we have found out by doing extensive work in India's rural pockets. And even in terms of national figures, the out-of-pocket expenditure is a huge part of what people spend on healthcare, right? It's more than half of what people spend on healthcare. And this, at least for rural families, this pushes people into poverty, because I'll show you how large these numbers can be, not from an absolute size, but relative to what these people actually earn. And and again, the interesting finding from secondary research and primary research is that so this problem is not limited to specific states or provinces in India. Every state has a variation of this problem, and every disease profile will require people to travel to a higher health facility. And when we started, even because it was the first time in India, these programs are shaping up, and we had done the first programs, so there was no data to say where drone deliveries will make sense. But after having done this work in different kinds of terrains, right? We've done this in mountainous terrains, we've done this in places that have good roads, we've done this in places that apparently don't have healthcare access problems, but we've found out that there are problems. The utility of technology spans across a wide variety of use cases and geographies within India itself, and that has been a great learning for us. And so some of these numbers are, in fact, all of these numbers are real numbers. Of course, I can't say the name of the facility because it's a public meeting here, but these are some of the real numbers that we have seen from our facilities, where if a person has to go from, let's say, one village to the nearest larger hospital, it can take as much as 1 to 3,000 rupees or even 4,000 rupees in terms of public transport, and spend like 1 to 3 days to get healthcare and come back. And these are in places that have good roads. At least the first three examples are in places that have good roads. And this happens because people don't have their own private transport. And if we see as a percentage of their income, and these are families that earn 5, 10, 15,000 rupees a month, and if they have to spend 3, 4,000, we are literally talking about 40, 50% of their earnings just evaporating because they were unable to get healthcare closer to where they stay. And so these are like real numbers denting families' real income. And this is a major problem that we set out to solve. What can we do as a drone delivery provider, right? What supply chain efficiencies, what supply chain improvements can we bring in the healthcare system so that people don't spend such sums that you see on the slide, but it's probably just 5-10% of these numbers, so that they not only get healthcare closer to where they stay, but also this money unlocks so much of economic opportunity for them, right? Imagine them spending this money on, let's say, education of their child, or them spending this money in their own economic activity, be it running a shop or be it running their agriculture. It just opens up so much of opportunity for the rural populations here. So these are significant sums of money that we have been able to save per person. All right. So if a drone is able to take a medicine or carry the sample of one person from these facilities, we're literally saving 30-40% of their monthly income. And at scale, you can only imagine what these numbers would look like. We're talking about millions of dollars that is saved for these communities at scale. And so these are some of the examples of how much OP that we're serving. And of course, the last example is from a mountainous region where the impact can even be higher because it's a double problem of not having a road and also not having a public transport. And so what we've realized is that it doesn't matter whether there is a road or not, whether the place is a mountainous terrain or not, whether it's a plain or not. But as and when you keep going farther away from the main hospital in a province or a district here, the access to healthcare becomes that much more challenging. So more than 7-10 kilometers is the sweet spot that we have found, right? So if you're within 7-10 kilometers of a larger hospital, then usually you will end up finding transport options. But if you're away from 7-10 kilometers, then the challenges start coming in. That's where the drone delivery starts making sense. So that is where we've been able to set up networks of targeting areas that are beyond the 7-10 kilometers radius from a larger health facility. And so overall, in terms of a solution, what we've been able to build out for our partners here in India is that so the drone is a very small part of the solution here, right? While the technology is solely focused on the drone, essentially what a drone delivery network is doing for our partners and customers in India is that it's creating a lot of virtual infrastructure. So imagine a patient earlier having to travel 50-100 kilometers, spend 1-2 days only because the larger laboratory is sitting in, let's say, a larger town in the district. And so the earlier alternative for any agency would have been to set up more laboratories in the smaller towns and smaller villages, right? That is how traditionally healthcare has expanded before drones. And so now that drones have entered the picture, there is no need for a partner to set up so many labs in a province, but instead having one laboratory and using drones as a hub and spoke model, wherein samples can be collected from any part of the catchment area. Similarly, cold chain products like vaccines and other critical medications can be delivered to any part of that catchment area without any additional lab being set up, without any additional warehouses or stocking rooms being set up, or without any additional cold chain points being set up. So in effect, drones are creating a virtual infrastructure to satisfy a lot of the healthcare supply chain requirements. And also decentralize a lot of the care. In fact, the last point here specifically talks about decentralizing treatments like dialysis, blood transfusions, sickle cell disease care, or HIV care. So earlier here, what used to happen is because these centers are primarily based in the larger hospital, patients used to travel all the way to the larger hospitals to get tests done, to get medications taken. But now with drones, the tests are being done locally because the samples can be flown in, and the medications and the treatments are also being done locally because the medicines also can be flown out. So in effect, a Redwing drone delivery program is adding a whole layer of teleportation by effectively creating a virtual infrastructure. So this is how the networks have been being set up for a lot of partners in India. And I'll request Rishabh to explain how the tech actually works, which allows us to make this happen for our healthcare clients and partners.
Yeah, thank you so much, Kundan. I hope everybody's sort of gotten a grasp on why rural healthcare in India is quite challenging, right? I think we also touched up upon out of pocket expenditure, right? Like so think of it like if you were sort of taking a holiday from work, and for whatever rhyme or reason your employer decided that this would be an unpaid holiday, right? Along with that, you had to spend money on transportation, right? So it's those expenses that sort of pile up for patients in rural areas. While a lot of people are privileged enough that that wouldn't make a dent into your savings, but it actually ends up making a dent into a lot of people's savings in, let's say, the rural parts of India, right? So I hope that's a little clear in terms of why we're stressing on that. Right, coming down to, let's say, the technology aspect, I think it's as simple as, let's say, placing an order on Amazon, right? You could what we do is we basically have an order management system. We'll sort of receive the order on our application, right? The order would be processed within the hub, within the drone hub, and the route for the drop location would automatically be fed onto the drone, right? These drop locations, usually the routes are pre-planned, right? So it's a fully automated route. The drone would also avoid tall buildings, hills, and it always flies, about 400 feet above the ground, right? So if you have a mountain in the way, it's going to fly about 400 feet above the ground, right? So we'll also deliver the package similar to how Amazon does. We'll sort of land or winch down the package right? And the payload would be retrieved, and then we would come back to the hub, right? So it's as simple as, let's say, an Amazon delivery system. You can think of it like that. But the vehicle that we end up using is a drone, right? Can you move to the next slide? Yeah, so there's a short video that I wanted to share with everybody, right, in terms of how it effectively works. So if we can play that video, I think it'll add a lot more clarity.
Is anyone speaking? You're on mute.
No, I think just wanted to sort of run everybody through the video. So this is how it broadly works, right? There's an order management system. We sort of input what is required from where it's required, right? This would select the route, and the route is fed onto the drone. Right, this is one of our older versions of the drones. Right, this is currently also flying in one of our networks that we have currently live. The payload is effectively packed by medical operators, the payload is loaded, and the drone sort of takes off and goes and delivers wherever it needs to, right? So I hope everybody gets a fair idea in terms of how the system effectively works. We can pause the video and move to the next slide. I think this is one thing that I also wanted to highlight, right? Certain areas where, deliveries used to take about 6 hours have been cut down to, minutes in some cases, right? These are areas which are, let's say, in, the remotest parts of, let's say, the Himalayas, right? In the northeastern states of India, right? Places which have not had access to medical supplies will also now have access to medical supplies, right? So these are the changes that we're trying to create with what we do here at Redwing. And in terms of, let's say, how we build, it's pretty simple for us, right? In terms of the products and the services that we build around our customers, right? It simply starts with gathering requirements. These can be requirements that the customer sort of informally or formally states to us. These can be not just, let's say, on the drone front. These can be in terms of, let's say, the software that they might require for running a particular network. These also might be, simple dashboards that the customer might require, right? So these requirements are then fed into our engineering teams, right? These requirements are then sort of distilled down into engineering requirements, and the engineering team then sort of takes over, right? We design, we prototype, we manufacture in-house, right? Currently, Redwing runs a ISO 9001 certified facility where we manufacture our drones. We also design our own softwares in terms of order management systems, fleet management systems, right? Log management systems for the drones, along with, let's say, the dashboards that we build for facilities, right? We also deploy these networks, right? I hope you understand, let's say, I hope everybody understands the difference between, let's say, these individual facets. For us, the drone is a part of the equation, but not the whole equation, right? Other parts of the equation entail the order management system that we, again, build for the customers. And then these are plugged into a network, right? So we would deploy the network and we would maintain these networks on a day-to-day basis too. So on the bottom right, you can see one of our networks and one of the hubs in the network, right? Yeah. Yeah, so I think over the last 4 or 5 years of our existence, Redwing has also been able to build a drone library in place, right? We've been able to build this library primarily because of the customers' requirements that have arisen over the last few years, right? These can range from, let's say, the range requirements, right? The customers might require, let's say, shorter ranges. Some customers might require larger ranges. These also can range from, let's say, payload ranges, right? Some customers might require smaller payloads. Some customers might require larger payloads, right? So the idea here being that, if you have a bunch of different items that you can plug into the final network, which is our product effectively, right? It becomes fairly simple for us to go to different customers and offer them a suite of services and products that we have in our arsenal currently, right? We can move to the next slide. Yeah, so this is again, right, like I was mentioning, we have a variety of softwares. These softwares are different for different locations, right? These softwares, because the way we interface with healthcare systems also differs from geography to geography, right? That's why our softwares also have to be different from, from geography to geography, right? Like it can't be the same software that we end up using across the board, primarily because our customers are in such distinct, different places in the country of India, right? So again, the idea sort of comes back to, let's say, having these individual modules for us. These can be the drones, the type of drones that we have, the software suites that we have, along with, let's say, the dashboards that we can generate for customers, plugging ultimately into, let's say, a drone delivery as a service or a network as a product for our customers. Yeah, I think so. I hope that gives everybody a fair idea in terms of how we build and how we try to solve this critical problem that we're sort of addressing in healthcare at the moment. Not only are we trying to increase the penetration of healthcare, we're also trying to solve the problem of out-of-pocket expenditure, right? And that's how we primarily solve it, right? And I think I'll hand it over to Kundan in terms of shedding a little more light in terms of how this looks like on the ground, because on the ground the reality is quite different, right? While all of us are engineers and techies in the end, but on the ground, when you try and solve these problems, it becomes very different from what you perceived it in, for example, your office, right? Over to you, Kundan.
Yeah, and in fact, some of the posters that you see are part of that entire equation that Rishabh was talking about, because different clients will ask different things as part of the program. So in fact, some of the locations, because drones are so new, adoption of drones was a major challenge that we had to solve in the first 3-6 months of setting up that network. So we had to directly work with the customer in doing a lot of community activities, sensitization work, so that people know that a service like this exists. In fact, some of the terms that you see in the posters, get your medicines within 3 hours, get your reports within 24 hours. This is literally taking Amazon level urban service standards to a rural part in India. And this is unheard of in most rural parts of the world, right? Similarly in India itself. In a city, I probably get my medicines in like 2-3 hours or 1 hour today, right? But in a rural area, to get your medicines within 3 hours from the time you order it is game changing. Now, of course, these numbers are always coming down, right? Where our efforts are always to ensure that the service standards keep increasing day by day, month by month, right? So, it's not going to be surprising if, let's say, tomorrow we make it to 2 hours, we make it to 1 hour, maybe eventually, like within 30 minutes of ordering, you will get a medicine. And similarly, getting your test reports within 24 hours, right? So normally these patients, as you've seen in the earlier slides, would have to travel for 1 to 2 days or 2 to 3 days, give their sample, get their test results. So what used to take probably 3-4 days, it's being done within 24 hours. And in fact, there are efforts already underway to bring this number to 12 hours and eventually to 8 hours and 6 hours, which is what the best of cities in India offer. So taking that service has completely changed the game for how rural healthcare is delivered. So creating this community awareness is a part of the activities that we do alongside with our partner, because a lot of these smaller things need to fall in place for the adoption of drone deliveries to be successful. And yeah, this slide is a very important one that we also use extensively with our partners and internally. So when we started, we knew that the impact of drone delivery will be huge on a rural healthcare service. But having run these networks for almost 2.5 years, we have data to actually see that story has been validated. In fact, the top diagram that you see is telling us that the effect of drone delivery is not on a specific population category or a category of maybe male or female, But across the board, right from infants who are like few months old to people who are more than 90 years old, every age group has benefited from the drone program. And of course, some age groups have benefited more because of the uniqueness of the specific geographies we operate in. For example, here 10 to 20, 20 to 30 is a larger age group because a lot of the programs that we have done are have been done where adolescent women or mothers were a large beneficiary. That's why you'll see some parts of that age groups more than others. But overall, what has been very heartening for us is that every age group or every demography profile is benefiting from a drone program. And if I can direct your attention to the table below, we can see that a lot of services either didn't exist before, or it took a lot of time for those services to get delivered. Diagnostics is something that we already discussed. So earlier there are no diagnostic advanced tests happening in the smaller health facilities because they didn't have a laboratory for that. So now with drones, it effectively created a virtual laboratory. In under 24 hours they're able to get their test results, which would have normally taken a couple of days for them to get that. Similarly, medicine deliveries, vaccine deliveries used to happen in a much lower frequency. But now if there's a vaccine that runs out during an immunization, the kids don't have to wait for the next immunization session to complete their dose, right? But on demand, the vaccines can be delivered when the session is happening. Or the patients don't have to be turned back because there are no medicines. The medicines can be delivered on demand, and the patient's treatment can be completed on the spot, or at least in the same day when if there is a shortage of medicines. And so what this has done is it has unlocked a lot of gains for beneficiaries, right, in terms of both money and time, which now can be put to more productive use. And also the other point that I mentioned in the beginning, that a lot of people were going outside of the healthcare net because they were not willing to spend the money needed to travel to a larger health facility. So this is bringing more and more patients into the healthcare net itself a lot. So we are in fact seeing some programs have more than 100% increase in the treatments that are happening, because now patients are able to get those treatments done at a local level itself, right? So they don't have to worry about traveling, spending couple of days, or spending couple of thousands and hundreds of rupees. So this is in a way work in improving rural healthcare. And both patients and doctors are pretty happy with the service, and a lot of them are vouching after doing months of deliveries that that drone delivery is not just a fad that has come and that will go, right? But this is a technology that has come and it's going to stay forever in their lives, right? So it has made a permanent dent in the way treatments are done, diagnostics are done, and healthcare is delivered in these locations. And not to mention that governments are directly involved in these programs. So a lot of the uh, commendation and a lot of the recognition comes directly from senior leadership of districts, of states where we are running these programs. In fact, both the larger networks that we're running in the states of Arunachal Pradesh and Odisha, we've received chief minister level commendations and awards for these programs. And on a lighter note, these programs, given the unique nature of tech that is being used, have been some of the most I would say celebrated initiatives in the health tech space in India as well, wherein uh, again, this is a lighter example, similar to who can become a millionaire, right? We have a Kron Vinega Crorepati program in India, where this program actually came up as a question in a quiz show. And coming to the ancillary and allied activities we do as part of these programs. So community events are something that happen along with these programs to bring more and more people into the healthcare net, so that drones can be utilized to the maximum extent possible in serving these rural communities. So a wide variety of programs end up jointly happening with the stakeholders or the partners at the ground level. And there are two other interesting things that happen along with these healthcare programs of creating technology STEM jobs and empowering local youth and kids who are young enough to decide career paths. And I'd pass it over to Rishabh to elaborate a bit more on what we do. And in fact, these are some of the things that we directly do with V Robotics and India Flying Labs as well as part of our programs.
Yeah, I think one of the most interesting things that we sort of found out during our community session is that when if let's say kids are a part of the the networks that you're running, right? Like the communities obviously like have youth, have various segregations of populations based on their age, but generally kids are the most active in terms of, let's say, talking about new things that are happening in their villages, right? So this is something that we realized early on, and we partnered obviously with the robotics and the flying labs to get this initiative out, right? The idea was again to train these youth in STEM, talk about drones, show them how drones are built, right? Not only involve them in, let's say, the activities that we do on the network side of things, but also involve them in activities that we do during our research and development side of things, right? This turned out to be a very great positive for us because these kids went back home and talked about drones to their parents, which effectively led to a much larger adaptation of this technology than we had sort of foreseen, right? What also started happening was along the way, a lot of these kids were more interested in joining our networks as a part of, let's say, the core team, and which truly happened, right? A lot of these members actually became members of our team. They sort of started flying the drones. They started participating in the day-to-day activities. Some even joined us as unpaid interns, right? So that's the sort of impact that we've been able to have with, let's say, partaking in that community and making sure that community sensitization just doesn't mean community sensitization for the name sake of it, but actually participating in that community and talking about what drones can really do. Right. This is again from one of our activities that we did in the school. Right. Kids were actually shown how to fly drones. Right. How to build these drones, along with, let's say, basically showing them first person view of how drones fly. Right. So that's an incredible learning that honestly we've also had, right? Making sure that kids are a part of the network, and what we've again realized that these kids go back home and talk about drones to their parents, which in turn leads to the drone sort of being adopted in a much positive fashion for delivery of healthcare supplies. Yeah. Yeah, Gundan, if you want to cover the last two slides, we can. Otherwise, we can do Q&As.
Sure. In terms of our commitment to sustainability, recently we've also become a member of the UN Global Compact so that we integrate more of the ethos and values concerning how to sustainably run these programs, right? And there are some things in the interest of time we've not been able to cover. Like one thing that comes to mind immediately is of environment and climate change contributions. So a quick fact is that electric drones are at least 95% cleaner in terms of carbon emissions when it comes to traditional land-based vehicles. So they're even cleaner than regular electric cars and electric bikes. That's how clean the electric drone is as a technology. And a lot of the partners that we work with who care a lot about climate change want to invest in that, want to partner up with organizations on that, right? So that's another part of the tech that we are working on, right, which I can briefly talk about. But yeah, this brings to the end of our presentation formally, and would request Elsa, if there are any questions, we can take them up in that order.
Amazing. Thank you guys. That was so great. So we do have a question, a hand raised. Go ahead and let me see if we can unmute
We have
you.
a question from Tanmay.
Thank you, Tammy.
His hand is raised.
I'm gonna ask you to go ahead and unmute yourself. You should be able to now.
Hello, am I audible?
Yes.
Yes.
Thank you.
So my question is to Rishabh and his fellow that what are the unexpected operational hurdles which you have faced, which were not the part of the basic calculations you have done to run this delivery program?
In terms of basic hurdles, I think one of the hurdles that sort of easily comes to mind is again, talking about adoption to communities which we're not natives from, right? This was definitely a big hurdle in the initial days, but again, we ironed it out again, like I mentioned, right, by involving the community on a day-to-day basis, making sure that they were a part of the drone program rather than just being beneficiaries to the program. I hope that answers your question.
And so there's a question in the chat. So how does drone logistics become a household name in the Indian delivery setup? Any plans to scale or thoughts on organic expansion?
Sure. So currently in India, what we have seen is that a lot of these programs are first picked up in the semi-urban and rural locations, primarily due to regulation. So regulation has been a great enabler in 2021. So that is a major landmark change that we have had in the Indian regulatory scenario that allowed drones to even start operating in India. And what those regulations have done is they've split the entire country into three zones: red zones, green zones, and yellow zone. So in fact, let me just show you that visual. It'll be just be easier for me to explain that. So yeah, the entire country has been split into red, green, and yellow zones. And what the rule says that if it's a green zone, then you can fly the drone without any central government or special permissions that are needed. And so this has allowed many programs to come up in the rural and semi-urban parts of India. And this is a map available online. It's for public consumption. And in fact, if you zoom into this, you will see that a lot of the metro urban cities are in the red zones, which mean that cities will see the adoption of this technology slightly later than rural India. Usually extremely high deep tech innovation start in the urban and go from rural. But here I would say it's a slightly reverse scenario where it's first starting in the rural and then going to urban. And this is not just with India. Even if you look at the global drone delivery success stories, you will see that the tech has first started in a lot of developing countries and then moved to developed countries. And a major reason for that is regulation. So it's still not a household name everywhere, but people are getting to know more and more about it. But in order to become a household name, more and more programs and networks need to start coming up in India, and we're already seeing fantastic growth happening in the Indian ecosystem, both from a rural and semi-urban perspective. But urban primary will take little more time because of the regulatory clearances that are involved.
Amazing. Anyone have any other questions? Don't be shy. It's interesting product, and it's also incredible what you all are doing, honestly, and so successful. And thank you, Rishabh, for sharing in the chat. You answered questions that I had actually on how many deliveries do you all do in a day? How do the people react to using drones for healthcare? And Rishad, you said the reactions of communities have always been great because to them this is something that is bringing healthcare closer to home. So this is about drones doing good, right? So it's absolutely amazing. And then you said 40 to 50 deliveries in a day. And each drone covers about 300 kilometers a day. Now you may have already covered this a little, but what does it look like with personnel? How many people do you need to just have logistically working on these projects per day to reach many people and do so many deliveries?
Yeah, so Elsa, I think it also depends on the sort of volume that we're doing in terms of, let's say, deliveries. Um, a very heavy network, which is doing a lot more deliveries, will have a lot more people, right, naturally. But again, it's an automated technology, so the number of people required, at least, is not that large, right, to operate it. Currently, we sort of hire again STEM skilled personnel to be able to operate our drones. We train them on it, right? Again, I think the answer varies in terms of, let's say, the number of people required to operate a network, but it can average anywhere between 10 to about 30 people for us per network, right?
Wow,
And and I'm not sure if there are more questions, but somebody raised a hand, Yusuf.
Thank you, guys. It was really an informative And just for your information, we are running an outage of internet connectivity within the ESC, like East Africa and other stuff. So it's bug out. You can just let me know if you don't hear me very well. My understanding is most of the time you will be flying kind of BVLOS, if am I correct. How does that been taken by your civil aviation authority? That's one. And the second thing is if that is really on the BVLOS is what I've understood. Does the system has a collision avoidance mechanism, and how does it really works with the terrain and respecting the flight path that has been predefined and stuff like that? And maybe just the last one, I have seen from the video, maybe I didn't understood it very well, when the request has been received, the package has been loaded to the drone, and the drone has been given the flight route. And then there was a pilot actually commanding the drone to take off. The end of the video, it's like the drone kind of landed by itself because it has to land, if I understood it, so that the package can be taken out from the drone. What is the mechanism of that drones going back maybe to the central part or maybe to the regional center in where it's came from? I hope my question has been clear.
Yeah, thanks, Yusuf. Could hear you loud and clear. I think I'll answer your questions. I think the number one on the BVLOS front, right? We do fly BVLOS. In fact, India is one of the most advanced, I would say, in terms of, let's say, regulatory environments in the world in terms of BVLOS. The India Drone Rules 2021 had come out, in August, right, which allowed for BVLOS flights to be conducted in green zones, right, without central and special permissions that are required. Right. So in terms of BVLOS, the regulators are more than happy for companies to operate in green zones, which is about 85% of the airspace of the country. Right. On the second question, in terms of detect and avoid or collision avoidance, right, we don't have any collision avoidance systems per se, but we do have precision landing, etc., all those other safety systems on board. Right. In terms of collision avoidance, we obviously always fly 400 feet above ground level, which is also the bottom ceiling for civil aviation aircraft. So we don't really have any sort of conflict in terms of civil aviation versus, let's say, the drones that we fly. Right. So that sort of eliminates pretty much all of detect and avoid for us. And considering that it's 400 feet above ground level, we will also not be hitting any tall buildings in rural areas, right? So that eliminates, let's say, the requirement for detect and avoid currently for us. And on the last question, in terms of the drone coming back, so we currently have a system where once the drone lands onto the node that we're delivering in, the operator can just push a button. The healthcare operator who's retrieved the payload can just push a button, and the drone returns to home after waiting, obviously, for a little bit to clear the complete surroundings, etc., Right, so that's how it works in terms of return to home. I
And in
hope
fact,
that answers all. Yeah.
Yeah, and in fact, that's an interesting question. The last question, right? That you noticed that the drone was landing. So and most of you would have seen lots of drone videos, right, from different programs and countries. And one thing some of you might have noticed is that there are some drones that don't land, right? You just drop, you parachute drop it, or you deposit it in some other way. The drone doesn't land. But in our video, you've seen that the drones are landing. And one of the reasons for this is that, or I would say the most important reason for is that in the Indian medical healthcare scenario, what we've realized after doing a lot of these pilots programs and interactions with clients is that India needs a bi-directional drone service, because the need is not just to deliver medicines and vaccines, but also pick up diagnostic samples for testing at a larger laboratory, which means that the drone has to necessarily land so that the payload can be retrieved, but also a payload can be loaded by the health staff at the smaller health facility. So that is why if you see a lot of programs in India, most of them are bidirectional drones, which mean that you have to have some kind of a land or a payload collection mechanism as well. And The good thing is that in the programs that we have done in the last 2.5, 3 years, right, we've been very fortunate to run operations in a very efficient way that we've never had a single loss of a medical product, right? While of course technical difficulties keep coming, at the end of the day, these are aviation machines, right? Even the larger Boeing Airbuses do have technical snacks, so we shouldn't be surprised if smaller drones are having technical issues. But having said that, we have never lost a single medical product in all of the operation that we have done, which goes into the care that we take of operationalizing these systems very well. And as a Yusuf, I'm not sure if you still have a doubt because I still see your hand raised. Let us know if you still have a follow-on question.
Not really a doubt. It was just kind of a follow-up question regarding the collision of other systems. My imagination will be like, in some points, you will not be alone operating on that network, for instance, since maybe the government has really done a great job to allow people to innovate and stuff like that. And in such kind of scenarios, if it is not happening now, how do we really preparing yourself, let's say ourselves, in together in making sure we still allow the civilians, the policymakers, the regulators, like the civil aviation authorities, still have more faith and not going to have a really rigid regulations to even in India, because I can tell you it is totally different in Tanzania. Just to give you an example, if you are going to fly 1 meter from the ground, your drone need to be registered and you need to have a permission to fly. And that's why it was really great. And just for your information, I had to snapshot that zoning mechanism, and I will go back to your to the website. At least they can share back to my civil aviation authority to say, guys, this is the direction which we need to move if we really need to do some kind of innovation as well in this area. So how do you prepare yourself in such scenarios in which there are multiple operators that needs also to provide the services that you're doing, so that we don't allow any drone to become collide in each other? And the other questions, though the Civil Aviation Authority doesn't seem really put pressure in terms of making sure we understand the routes operators. Are there any mechanism in which you are using to make sure you are preventing the collisions in one or another, maybe on other someone else flying the drone on the similar area and stuff like that? Are there any system in place, or maybe what is happening there? Asante.
Sure. So no, it's a very valid point, and I'd like to throw some light on what's happening in the Indian ecosystem to address that. So right now, the scale at which drones are adopted, right? We've still not faced those challenges where there's so many drones operating of different companies in an airspace. But having recognized that the growth is going to geometrically increase in the coming years, the government is already working on a policy of unmanned traffic airspace. It's called a UTM in technical terms, wherein similar to how civil aviation has ATCs set up and you can track what aircraft are coming from where, the Indian government is already working with, set up working groups and is working with a lot of partners to have a system like that even for drones, where tomorrow, exactly the point that you mentioned, let's say there are multiple drones flying, there's an agricultural drone flying, there's a delivery drone flying, maybe there's some other drone flying. We will have an airspace management system where the administrators will have access to what kinds of drones are flying in which route, so that collisions between drones don't happen, right? I hope that that's the short answer to your question. And that is on the regulatory side, but also on the company side, right? Fairly advanced companies like ours are already gearing to build tech that will ensure that even without an airspace management system, right, drones will be able to detect, let's say, oncoming drones or even any other obstacles to mitigate those issues. And yeah, I think as a closing remark from at least my side, right, what I'd like to stress to the audience here is that a couple of years back, when drones have not started picking up a lot, right? I'm talking about like 5 years before countries like Rwanda and Ghana picked up drone networks. Drones were always seen as a very advanced form of transportation, maybe not relevant to larger parts of what the world is doing in healthcare supply chains. But what programs have taught us, both outside of India and even inside, even within India, where we are largely operating these huge networks, is that drones are not meant to be seen as a utopian technology, which is relevant probably in a place where you have big mountains or, let's say, waterways to cross or islands to reach. But what our experience has taught us, and what also experience from other countries has taught us, is that this is a technology that has come to stay. And this is a technology that is going to replace a lot of the legacy way of running healthcare, of setting up so much infrastructure, which is often not functional, right? And so this mechanism of drones replacing physical infrastructure, of expanding access, of benefiting large parts of populations, expanding large parts of health programs, is not going to be limited to extremely challenging geographies, but applied to a large part of the developing world. And even, in fact, even urban deliveries are happening, right? In fact, if you Google up stories from Australia and Ireland and the United States, even urban deliveries have started happening. So if any of you are working with governments or policymakers or large not-for-profits or foundations that are looking at health technology specifically to expand the reach of healthcare, drones should definitely be on that list, right? Because drones should not be seen as, at the end of the day, yes, they're transporting machines, but as you've seen in the examples today, right, the whole impact and the intervention is going to change once you bring drone into the story, right? It's going to unlock health treatments. It's going to unlock things that are otherwise never not possible with regular transportation mechanisms. So that is going to be my closing thought today, that don't see drones as a very siloed or a very limited technology, but it's a very broad-based technology that can be used to improve healthcare access and equity. So that'll be my closing thought, and would request if Rishabh wants to add anything.
Well, nothing to add. I think just double clicking on Kundan's point, right? Drones are not just in healthcare, right? They're in multiple other aspects too. So not to look at them again, as a utopian technology that doesn't currently serve you, right? It's already happening in various parts of the world. While while you might not see, let's say, your food getting delivered by drones, but drones are making real impact to real people's lives on a regular basis, right? So again, if anybody's sort of connected with healthcare bodies, with aid governments, right, happy to sort of have a good chat and talk about how drones can sort of improve the current state of infrastructure that currently exists in each of your geographies. Yeah, I think those will be my closing remarks. And thank you so much, Elsa, for taking the time out today. Thank you, everybody, for joining today. And I hope you guys have learned a little bit about the work that we've done here at Redwing. And I think there's a lot more to do. And this is just a start. Thank you so much for joining. Yeah.
Wow, you all are doing such great work. Keep it up. Thank you so much for doing this webinar and everyone for joining. Really look forward to keeping up with your work and seeing how you all do. And I'm very encouraged by this webinar. So thank you all. I hope you have a great rest of your day and take care.
Have a nice day. Bye.
Thank you.
Bye, everyone. Thanks so much.